Hi, this is Dr. Cynthia Clark, acupuncture physician, applied clinical nutritionist, creator of Energy Evolution, president of Longevity Wellness, and today we are talking about Progescence Plus, which is an essential oil blend that looks like this. It comes in this pretty clear bottle. It is for external use only. This is not an internal herb. It's for external use only. And I have both the Progescence Plus US and the European sheets, product sheets on it, which I thought was kind of interesting, the differences between the two. But what I want to go over with you today is a document that was published by an MD, Dr. Dan Purser, in the summer of 2020 to go into more detail about Progescence Plus, how it can be used, and when it's safe to. Because we are talking about an oil that stimulates progesterone in the body. So there are times when that's safe to do, and there are times when it's we want to be aware of the context in which we're doing. So first of all, there is a statement on the package about this that is required by California law. That is a warning about a cancer-causing agent, and the reason for that is because, first of all, it's an outdated statement. However, the law doesn't update, and the reason for it is because the law doesn't differentiate between synthetic and natural hormones. Synthetic hormones are absolutely shown to be cancer-causing. Natural hormones are not. However, so natural human progesterone has not been shown to be cancer-causing, and in fact, quite the opposite. So there are no cancer-causing agents in Progesterone Plus. Of course, that does not mean if you use Progescence Plus, that you're not ever going to get cancer. Many things are causative factors for cancers. Benzene inhalation being one of them, which comes from cigarette smoke, or industrial fumes, and that doesn't have anything to do with Progescence Plus. Okay, so let's go through a few of the questions. First of all, if you're taking birth control pills, then we recommend not using Progescence Plus. And the reason for that is because we don't want the association, because birth control pills are cancer-causing agents, and we want to be clear to separate these two and not have any confusion against them. If you've had breast cancer and your doctor says not to take any hormones, and why not to do that? And that's because synthetic hormones have been associated with breast cancer, and all hormones can be lumped into the same category. So it's the same sort of situation, the basically bad press. If your doctor says not to take Progescence Plus, then I would first evaluate whether or not your doctor has a body of knowledge connected to that. Does he or she understand the recommendation that they're making? And if not, then you might want to seek out a doctor that is familiar with your choice of treatment and curative agents. If you have had progesterone receptor positive breast cancer, can you take Progescence Plus? Again, this is going to be a conversation you need to have with your doctor. Studies show that is a time that's actually very important to use natural progesterone, but you need to talk to your doctor first. What about taking Progescence Plus while pregnant? Ray, I know this is a big thing for you. Yeah. And the answer for that is you do not need extra progesterone while you're pregnant. You have plenty, so you don't need Progescence Plus. If you have endometriosis, is Progescence Plus safe to take? Actually, yeah, absolutely, and it will probably help your endometriosis. It will probably help. Another question was, I'm 18 and have severe PMS. Is it safe? Absolutely, it will probably help. I have menstrual migraines. Is it safe to take? Yes, natural progesterone. It will probably help. It has a positive effect on migraine headaches. I've had a hysterectomy, so why would I take Progescence Plus? This is one of my favorite questions. Lack of progesterone can occur whether your ovaries are there or not. And as a woman, you need a sufficient amount of progesterone to balance your hormones. So just because you don't have the parts that are making the hormones doesn't mean you don't need the hormones. I've had blood clots from birth control pills. Is Progescence Plus safe to take? Synthetic progestins are known to cause clots, while natural progesterone has been shown in a number of studies to not cause clots. Of course, talk to your doctor. but it is Dr. Purser's opinion that it is safe to take Progescence Plus without increasing risk of blood clots. If you've had a stroke or heart attack, is it safe to take? Natural progesterone has been shown to reduce vascular inflammation and heart attacks and strokes in women. This is a product that is for women. Have high blood pressure, is it safe to take? Progescence Plus is shown to lower blood pressure, so that's great news. What about insomnia? Progescence Plus and progesterone has been shown to improve depth of sleep. Hot flashes, night sweats. Progesterone has been shown to improve these 98% of the time. There's also another Young Living product called Femigen, which increases estrone, so that can help with the rest of it. Low libido, progesterone and Progescence Essence are safe to take and should improve libido. But warn your honey first. The bottle is clear. Why is that? It's in a base of wheat germ oil. We don't actually know why the bottle is clear, other than it looks different from the other Young Living oils. It is in a base of wheat germ oil. So if you are celiac, this is not for you. Can Progescence Plus be taken with thyroid medications? Absolutely. Synergistic effect. Go, go, go. It's good. It's good. Implications of Progescence Plus on MS patients, so multiple sclerosis. The implications are really good, and you probably need to take a higher dose. Symptoms for low progesterone seem to be very similar to the symptoms of lupus. Can this be the hidden cause of lupus or SLE? Maybe, and it definitely won't hurt to try. Okay, so how do we go about taking it? 1 drop at a time. So as you start, you're just going to put 1 drop on either on a part of your arm that doesn't have any hair on it, right there. Or you can put a drop on your neck or on the insides of your thighs. And start with just 1 drop. For some people, this does positively, in a good way, make them sleepy. So better to take it at night when you're first trying it. When I first started using it, I didn't have that experience at all. I didn't have any problem taking it during the day, and I felt good on it. Again, this is not oral. Do not take this in your mouth. It smells fantastic. Don't eat it. Don't drink it. Most likely you want to use it daily, and just like if you've ever used that the yam extract and you rub it on one area and you rub it on your other area, it goes exactly the same way. Same sort of situation. Now, sometimes when people start on products like these, they'll have symptoms like headaches. What's happening there is that this is flushing through some vascular inflammation. If you have that experience, try more and try to push through it. Drink your water. What is happening is a bit of a healing crisis, but you'll be better off in the long run for it. Several questions about high cholesterol. So Progescence Plus and progesterone usually causes a drop in cholesterol, usually causes a drop in blood pressure. Again, this is not for men. It will tend to decrease their libido and cause vascular inflammation in men, because men were not designed to have extra progesterone kicking around their bodies. If you're using Depo-Provera, do not use Progescence. The reason for this is because these are synthetic hormones which cause vascular inflammation and thus blood clots and strokes or heart attacks. Human or natural progesterone does not do this. We don't want to associate Progescence Plus with Depo-Provera, with the synthetics, because if the research community can't differentiate between the two. You've conducted an experiment with both of these in your body, and it's not a wise experiment to conduct, both for your own personal experience and also for the public at large's awareness. It doesn't make sense. Is it safe to use with bioidentical hormone replacement therapy? Yes, absolutely, and it will probably help. Is it safe to use with synthetic progesterone? Same answer. we don't want to mix because synthetic progesterone has been known to cause a number of cancers. Will it balance estrogen dominance issues? Now, this is really important. We've been talking about this a lot lately because an estrogen dominant state in the body is a tumorigenic state, a cancerogenic state. Adipose tissue, fat, is an estrogenic material. It produces estrogens. So for women, progesterone plus will likely balance that estrogen dominance. Okay, many women do lose weight on Progescence plus, but the question comes, I'm not losing weight on Progescence plus, why? And the answer is there's more than one reason for weight gain. So your weight gain might not be due to progesterone imbalance. It might be due to toxicity. It might be due to nutrient timing, which is one of the most important ones. So, or it might be due to pathogenic load. So when taking this, do try to avoid carbs and eat more protein because progesterone tends to be a little bit anabolic, which is muscle burning and muscle building and fat burning. Okay, just a couple more questions I want to go through. If I have heavy menstrual bleeding, is progesterone plus safe to take? Yes, absolutely. I'm 60 years old and still having periods. Absolutely, this is safe to take whether you are 25, 35, or 75 years old for women. My daughter has menstrual migraines. Should she try cycling Progescence plus to see if this assists? Sure, but honestly, the idea of cycling may or may not be valid. You could try a little bit of it all the time. If you are working with me or a qualified muscle tester or applied kinesiologist, that's going to be the best way to go about determining your dosage for this. If you start using Progescence plus and you start to break out, that's actually a good thing. We're venting toxins that have been locked in the body. If it gets really bad, it doesn't go away, then just stop using it. It's okay. But oftentimes it's a detox process that the body is going through. Does Progescence plus reduce my own production of progesterone? Now, this is a really, really, really great question because it's very important. Are we outsourcing the body's own ability to produce things that we need and training the body to not do things that it needs to do? And that answer is no. This is more like food. This is more like the nutrients that you need. This is why it's so important to use natural rather than synthetic, because natural supports and synthetic is going to be that cancerogenic agent. You can get your progesterone levels checked to see if you need progesterone. Symptoms of progesterone deficiency are hot flashes, night sweats, migraines, low libido, and depression. So I hope this has been helpful to you. Again, this is information that was published by Dr. Dan Purser in the summer of 2020 about Progescence plus.